Hello everyone, this is Ben and welcome to my channel. The title of this channel is The Diary of a Burnout Physician, and this is the introduction. Well, I am a practicing physician. I've been in the medical field for about 40 years. Recently, since I'm close to retirement age, I was thinking about just calling it quits. Look at my numbers and say, hey, this can be done. Why don't I just, quit, retire, and tell people it's not my problem anymore. So last weekend, I was able to go up to the mountains and spend the night over there. And as I was looking at the stars that night, everything was so peaceful. I was able to get a better perspective of what's going on. And in medical practice, the most important thing is the diagnosis. So the diagnosis actually is burnout. And that's really not new to me. About 12 years ago, I was taking my board exam. It was a lot of stress, so I did get the help of a coach at that time. Fast forward, 12 years now. In the last 3 years, actually, I changed different job. I've been in this city since 2016, and this is my fourth job already, and for quite a few reasons. Also, last year, I went to the emergency room with a bad headache. This year, I have a kidney pain. I have a flank pain and also blood in the urine, and scans show that I have a lesion in my pancreas. So at one point, I thought I had pancreatic cancer. But anyway, all of this created as this way. It's a perfect storm. And as I look into YouTube, I noticed that there's not a lot of videos about physician burnout. And it goes back to like 7-10 years ago. So what I did was, just like the way I learn anything is to, buy some books, and I've been reading, and also sign up an app and a phone for a cognitive behavioral therapy also. So this is what I found. I mean, first of all, what is burnout, right? It is exhaustion or tiredness. It can be physical, mental, or emotional. And what are the causes? So far, I found out that number one, perfectionism. And that's, of course, key for every practicing physician, because throughout our training years, we were taught to be perfect. The standard is high. Why? Because if I make a mistake, someone can lose their life, right? I remember doing my training. One time I went to this surgical mortality conference, which means I have this meeting when there's a bad outcome, meaning the patient died. And you should see how the resident was grilled. He was in front, and all the attendees were asking questions. Why did you not do it sooner? Why did you do this and that and that? So that's what it is. Even in family medicine, it's the same thing. I remember one time I was in practice, and a patient's potassium was not doing well, going up and down. He was admitted to the ICU. That night, I slept in ICU. I slept in a bed next to him, actually. Anyway, so that's what it is. Perfectionism that leads to burnout, right? Number two, anticipatory anxiety. And yes, this may not be only, of course, in medical practice, it can be anything, but in the medical practice, for me, in an outpatient, sometimes you see a patient's name in the schedule and say, oh my God, so-and-so is coming back. I have to deal with this, I have to deal with that. So there's that anticipatory anxiety. Well, the fact is sometimes patient no show. So I just wasted all my energy worrying about it. Number three is low self-esteem. I think this is attached to the perfectionism we talked about earlier. In the growing up years in our training, if we were constantly pushed down saying, hey, why do you do this, why do you do that, and all those things, that creates a low self-esteem. And because of that, that adds to the stress of practicing medicine, and that leads to burnout also. Number four, constant self-criticism. Well, I call this the abuse became the abuser. What do I mean by that? Growing up, my father wants me to be perfect. Every test has to be 100%. If I've got a 100% straight A, I get a reward If I miss 99, I get beaten up actually. So that is for me, because of that, and throughout, like I said, about my medical training, it created that constant criticism. And even though my dad passed away already, all my senior physician, whoever's training us, they're gone already, they're not with me anymore, but still, sometimes that criticism is ingrained, and like I said, the abuse became the abuser, right? The last one is lack of boundary and assertiveness. And yes, this is something interesting. With my new job right now, I realized that unless I ask for it, they're not going to give it to you. Supposedly we should have a 4-day shortened week, but after 90 days, I have to ask. I say, hey, it's been 90 days already. Can I get my 1 day off to do admin, to work from home and things like that? So that's assertiveness, and also boundaries. Yeah, that is something that is challenging for me. Like, if the nurse has a triage question, come to me, and that actually is not my patient, and the provider here in the office, or the provider should be working from home, kind of hard for me to say, hey, no, I'm not gonna do that. Especially this nurse that's working with me, she's good, she's experienced. I really have fun working with her. So, and also besides, I just started, schedule is not too bad. So I've been doing that, but I realized that that's something that's important, is the boundary. So a quick recap of factors that can lead to burnout. Number 1 is perfectionism. Number 2, anticipatory anxiety. Number 3, low self-esteem. Number 4, constant self-criticism. And number 5, lack of boundaries and assertiveness. So in the last few days, when I have all these books and readings and things like that, I learned a lot. I wrote down in my note here, and that's why I would like to share with all of you. If you are a practicing physician, yes, take a moment and say, hey, what's going on here? I was reading that last year, Medscape, they did this National Physician Burnout Survey. Still about 50 to 55% of physicians are reporting burnout, all right? So it's there. There's a lot of talk about also for medical students, for residents, and also, of course, for practicing physician. Burnout is important to address, because if a physician is burnout, then it affects the care that we give to the patient, right? I remember also recently when I was trying to make the decision to retire, it was a situation where the coders, right? So we use electronic medical record. Coders sent me a message saying, hey, you need to verify the history. So I said, what's going on? I went back to the chart: diabetes, high cholesterol. Okay, metformin, atorvastatin. What else? So I sent back a message: chart reviewed. This is a diagnosis and treatment. What else do you want? Right? So I was irritated. That's another symptom of burnout. And yes, so this is time not for me to retire, but for me to finish this contract. It will save me some money, and also make my retirement a little bit more comfortable after 2 years from now. And also, this is a topic that I like to address. And since I know the diagnosis, then it's easy. Then we'll go with the treatment. Okay. Anyway, so this is a new channel for me. It's a diary of a burnout physician. I hope you learned something. Welcome. Thank you for stopping by. I will continue to present other concepts that I learned throughout my reading, and we'll go from there. Okay. Until we meet again, thank you and take care. Bye.